Thank you, Mr. Speaker. Sir, Honourable Speaker, Honourable Prime Minister, Honourable Leader of Opposition, Honourable Cabinet Members, Honourable Members of Cabinet, Members of the public, a very good evening to you all. Mr. Speaker, sir, in his address to the nation, the Honourable Attorney General and Minister for Economy, Civil Service and Communication, in delivering the 2019-2020 national budget, said, "Government is committed to protecting and improving the health of all Fijians, regardless of income or geographical location. The government aims to achieve this through a wide-reaching and holistic approach, from the provision of preventative, curative, and rehabilitative medical care and treatment, to the encouragement of healthy lifestyles, to the training and education of a healthy public. The Ministry of Health and Medical Services is tasked with achieving government's vision of a more modern and affordable Fijian healthcare system. The Ministry is actively improving and bolstering its internal capacity alongside partnering with outside experts to address the specific health needs of the Fijian population. It is seeking out innovative ways to deliver high-quality medical services and health education that reaches every Fijian community, no matter how remote. This objective has been further consolidated by the Fiji First Government and Aspen Hospitals of Australia. Mr. Speaker, sir, to meet today's demand in health services, the Ministry is constructing, upgrading, and refurbishing divisional and subdivisional hospitals, health centres, and nursing stations throughout Fiji. This government is dedicated to filling these new and improved healthcare facilities, along with those that already exist, with modern, state-of-the-art technology and equipment and skilled medical professionals. Improving the provision of medicinal products, strengthening the health workforce, and improving the health information systems are other focus areas for the Ministry. While government is putting extensive resources behind upgrading the nation's healthcare network, it remains dedicated to keeping the out-of-pocket cost of healthcare borne by ordinary Fijians to a bare minimum. From womb to tomb, affordable healthcare is a fundamental and constitutionally enshrined right of every Fijian. Mr. Speaker, sir, initiatives for the Ministry of Health and Medical Services in this fiscal year are in improving the administration and quality of healthcare and medical services throughout Fiji. The human resource responsibility of doctors has been transferred back to the Ministry of Health and Medical Services. Community health workers currently based in villages and settlements are now receiving an allowance and will soon be provided with a dedicated dispensary to house essential medications. The dispensary will be equipped with a PC to capture patient data to support the patient information system held at divisional hospitals. These prefabricated cubicles will be equipped with external USB ports for villages and communities to get free access of charging their cell phones. The Ministry continues to enhance access for patients seeking overseas treatments, particularly for cancer and cardiac treatments that are not yet available in Fiji. The Aspen Hospital, once fully operational, will provide procedures and care in this respect. The Ministry will continue to strengthen the delivery of secondary prophylaxis, increase community awareness, define the epidemiology, and monitor the burden of rheumatic heart diseases by allocation of funds. Provide funding for aircraft charter to meet the increased demand for medical evacuation of high-risk patients, especially those residing in rural and maritime areas. The Ministry will continue outsourcing janitorial and security services for all health facilities. The Ministry will continue to address the rise of non-communicable diseases by strengthening preventative and outreach programs relating to NCDs, HIV/AIDS and tuberculosis, family health, adolescent health, child health development, environmental health and mental awareness. Mr. Speaker, sir, I look forward to continue working together with the Honourable Minister for Health and Medical Services, the entire ministry staff and allied workers in taking forward the ministry's vision of developing a healthy and productive population. With this, Mr. Speaker, sir, I fully support the 2019-2020 budget, and I thank you most sincerely. Thank you.